correct that.
Look at that handsome boy. His name is Case, and he proudly belongs to Emily Daniel, who is the practice manager at Animal Medical Professionals. They were on recently. Dr. Tina Fields was here when my daughter Meg and her cat Margot were on the show. And little did I know then, welcome back by the way.
Thank you.
That y'all were awarded Best of the Best.
Yes, ma'am.
Congratulations.
We're excited about it, and we're happy that our continued work of trying to make, the clients happy and practice good quality medicine is being recognized. So
let's talk about that, keeping the clients happy, because hopefully if you're a pet owner, you're going just kind of for your maintenance visits, if you will. You don't want the pets to have illnesses and to be sick. But even with those annual or biannual visits, if you're lucky, you really click and it feels like family.
Yeah.
It sounds like that's what y'all want.
Yes, absolutely. And like you said, our goal is preventative medicine, but yeah, I have several clients that I know them by their, first name. I'll see them out at the grocery store. They've seen my kids, and the longer I've been at AMP, the more of those clients I'm getting, and it's fun. I'm usually not the most extroverted person, but these people bring out a side of me that I never knew was there. So I really do enjoy seeing my clients.
We'll talk a little bit in generality about the practice in a second, but I do want to ask you, Emily, as the practice manager, where Dr. Fields is one-on-one with the animals, you're often probably the one dealing with the owners, right?
Yeah, that's part of, I guess you could say it's halved up between owners or, HR related stuff, so the staff behind the scenes. But and before I was a technician, before I got into the management side, so I'd already developed some relationships with clients just from assisting with their healthcare needs. And it's super important to both of us that we have a long-term relationship with clients.
Yes.
Always.
Well, and that's kind of where I was leading you actually, was because before you ever get into the exam room with you, it is that technician force and the front desk team that totally sets the tone. And from everything I hear, it's welcoming the minute you walk in the door.
That's what we try that's how we try to train our staff, is communication and client-based experience, and obviously fantastic and thorough care for pets. That's our goal.
Okay, so you were here with us with Margot, who at the time was a 4-month-old kitten. She's approaching 5 months old now. And when we were finished talking, you gave Meg a type of a flea and tick preventive, right?
Yes, ma'am.
That's always changing the recommendations. What was it that you gave her?
So I gave her NexGard combo, which we give a free sample to in every puppy and kitten room. But essentially, these medications are, medications, treatments, care is always changing. Just like we mentioned in our last segment, the recommendations for spay and neutering is changing. So it's really important for us to go to continuing education, which Emily is, she's a certified practice manager. She's required CE, I'm required CE, and that's where veterinarians, are going and learning about all these new changes. So it is really important to stay up to date on medicines and recommendations of treatments, because it's ever evolving, and we're ever evolving as well.
I've had many pets in my life, and I've loved every single one of them. And probably with all of them, there has been some type of an emergency situation. Not always after hours, but just urgent. Yeah. Y'all are a small practice, which is part of what allows you to have that family feel. But do you work really hard to help people in those crisis moments?
So our founder, Dr. Dickinson, that has always been his core value, is accommodation. And yes, we're one of the few privately owned practices in Chattanooga that offer walk-ins and drop-offs. So that is our goal, is if somebody's in need, we're there to our best ability to help them. So
I'm going to go maybe down a slippery slope, but y'all work with me here, because I think you just said something really important, because you just said privately owned.
Yes.
That's really important.
Yes.
I'll let you take it from there.
Well, that's all Dr. D. So we're going on 20-year anniversary, and he's built this practice to something amazing, from one doctor working 6 days a week to now 5 doctors. It's a huge practice, but our goal is the small family feel. And I just recently partnered with Dr. D, so I'm now a co-owner there, and I've been invested in this clinic for 8 years almost. So he's very proud of it. I'm very proud of it. And our goal is to try to keep it that way, because
Right.
you hear of these corporations coming in, and I'm sure not all of them are that way, but the quality of the staff declines significantly. Like their quality of life, not the staff. And that's our goal too, is not only our clients and their pets, but also our staff. That's been our goal, is to just make a great working environment for everybody.
It's something that you wouldn't necessarily think of if you're kind of new into pet ownership, of really what the veterinary practice looks like that you choose to go to. But I've learned as I've gone through life, and so I did want to give you a chance to make that clear, because I think it's very important.
I think it does become more talked about now. Like, we even have clients coming in and they've left a corporate, or they're asking like, are you guys corporate or private? So we are like, no, we're privately owned, and you can tell it makes a big difference. Vet care is expensive, period. And it's not because our prices haven't gone up on the back end. Like, for us to get supplies, it's just astronomically increased for everybody. But being privately owned, we're able to help keep our prices lower because we don't have a huge overhead.
Right.
And that's part of the goal too, is because we want people to be able to afford to care for their pets well.
And they've got Case to go along with it. Is he there in the office sometimes?
Sometimes, yeah.
Sometimes, if
Yeah.
you're lucky enough. How old is he?
He's 7.
7
Yeah.
years old. He's a pretty chill doodle.
Well, he's a poodle.
Oh, he's
But
a
yeah,
poodle.
He is.
Oh,
Hey, that's
It's okay.
Everything's
Everyone
doodled.
thinks he's doodled.
I
So
owe you such an apology,
he's not.
Kate. All right, here's where you will find them. Animal medical professionals. They're on Main Street in Ooltewah, not far from the Whistle Stop Cafe, if you know
Right.
where that is.
Right.
238-5870 is their phone number, ampvetclinic.com. Privately owned. Great to see you.
Thank you for having us.
Sorry, buddy.
Hi, I'm Trevor. Welcome to